This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center. I'm going to discuss the forms of ketamine therapy that are available. When I say forms, I'm referring to whether it's going to be intravenous, oral formulations, or intranasal, etc. So ketamine does exist in a right-handed and left-handed form, and we see the left-handed form, the S form, which is actually on the right side here, and that's called Spravato. Spravato is just half of the full version of ketamine, and that's been FDA approved since 2019 for the office use of depression and treatment-resistant depression. Now, the R form, which is the right-handed form, is the mirror image of the left-handed form. But when we use ketamine in the office as infusions, we're actually using a 50-50 mixture of both formulations. So individuals get the benefits of the right-handed and the left-handed forms. And there are said to be variations of effectiveness that the S form is more powerful by about 2 to 4 times than the R form, but that the R form has a better antidepressant effect based on certain rat studies. But again, when a person uses IV formulations for depression or even compounded racemic mixtures from a compounding pharmacy, they're getting a 50-50 mixture of both. And that's beneficial for depression either way. So the first and most effective version of treatment is with intravenous formulations of ketamine. You can see on the right here that ketamine comes in these bottles, and these are dripped in through a vein in the individual in rooms such as these on the left-hand side. And again, the drip is generally over 40 minutes. The dosing is generally between 0.5 milligrams per kilogram, and that's ideal body weight, up to 1 milligram per kilogram ideal body weight. And generally, we just escalate the doses with each visit so that the person is completely comfortable. And as you can see in these infusion rooms, they're more like a home-like environment and less medicalized. Again, the lighting is generally very ambient with like Philip Hue bulbs or galaxy lighting or different types of lighting structures, as well as a comfortable chair and also music as well, which can either be placed in there, or individuals would just bring their own music with their headsets and just kind of enjoy the intravenous infusion. There's also racemic home nasal spray of ketamine as well. And when I say racemic, it has both right and left-handed forms of ketamine, so it's a 50-50 mixture. And this is made in a compounding pharmacy, and it's sent home with the patient to be used in a prescriptive fashion. The individual will just spray this in their nose at specific times and obey specific guidelines. And this is a great way to help maintain the efficacy of ketamine infusions and also maintain the neuroplasticity as well. Some individuals will use this as a method of kind of alleviating anxiety and acute depressive disorders as well. And then there's Spravato, which is S-ketamine, and it's only administered in the office, initially twice a week for the first month, and then weekly thereafter. And this one, again, is extremely expensive. It's basically something that would be obtained through insurance. I think a vial would be somewhere over $1,000. And this is got a specific risk mitigation program. So when this is used in the office, the individual has to stay in the office for a few hours, and they can't drive for a significant period of time afterwards. Then there's also ready-to-dissolve tablets and troches. And we can see in these upper pictures on the left and also in the middle, these tablets that are what we call RDTs. And they're more chalky. They're placed in the tongue for about 10 to 15 minutes, and they're just allowed to dissolve, where they basically get absorbed. And somewhere between 20 and 40% of the ketamine in this tablet will get absorbed and slowly diffused to allow for neuroplasticity. And then there's troches, which are a little bit, harder, almost like a butterscotch candy consistency. And those can also be placed into the tongue for absorption.